Thank you. Just a follow-up on that question. So there's been a lot of talk of the Valley of Death. And the Valley of Death is, it's about the translation of technology into the commercial realm. It's a very appropriate strategy. But when we talk about global health, some of these technologies may not be that profitable. And I'm just wondering about, and following up, in terms of local solutions and innovations that are happening, my question is, as we patent these technologies and license them exclusively to spin-off companies, for example, what are the patent thickets that we're creating, and how are we potentially driving down innovation that could happen at the local level? And would it be perhaps more appropriate to release some of the IP through an attribution license rather than an exclusive license?
Can I
Yeah,
go
sure.
You know, we're actually struggling with that one right now with some of this new paper technology stuff. And I don't know if you've followed George Whiteside's, he has this Diagnostics for All nonprofit. But the reality is that there's multiple countries, and each country's got its own situation. And you don't patent globally, you patent in particular countries. The reality is there's large parts of the world where nobody bothers patenting. Okay, and patents really don't inhibit you from manufacturing in developing world countries or from someone doing it. So the reality is it's not one problem, it's a cluster of problems. And again, one of these things that I think was underappreciated 10 years ago, I've watching the Gates Foundation go through this stuff, it's something that I've seen them struggle with up to, you know, this very month, where they're sort of figuring out how do you go get US companies to innovate for how can I say, for products that are primarily of use in the developing world, while simultaneously allowing them to preserve rights to make money on those things in the developed world. It's not a simple problem. I think the answer is no one's ever going to write a patent that's going to prevent someone from selling something in a country that really has serious need. I don't think it's done.
Yeah. Unless you can find a different way to exploit it. And then we go back and forth talking about, well, what if we started, you know, it's this whole discussion of whether you're going to be a social entrepreneur and start a company that will be sustainable for the technology, or whether it's going to be a charitable entity only. But you know, what model you follow is it's very complicated, and there's a lot of discussion about that right now. I don't think there's, I don't know about what experiences you guys have had, but with this kind of thing, it's low tech, and it's not considered that we would ever be able to market it in the US and sell a whole bunch of parts, but we might be able to make it, you know, somewhere else and sell it more cheaply and with a small amount of profit for a local company or organization.
I think my experience may be a little bit different. The companies that hold the IP for the production of the materials are going to make money in mass production. And mass production requires markets. And so if you can increase the market for the use of especially chemical, some of the ones that I talked about today, which are expensive to produce in small quantities but are very cheap to produce when you produce lots of them, they're looking for the markets for their materials. And when you start to expand the markets to a few billion more people, it really helps the bottom line. And it changes all the cost models in production and sales and all those kinds of things. But there's not a lot of money in specialty chemicals, but there's huge money in bulk chemicals. And so the companies that hold those patents or have purchased those patents from universities are really interested in larger markets to bring down costs of production and make much less per gram or much less per kilogram, but sell a lot of kilograms. And so, but that takes the IP out of the university infrastructure. I don't usually seek IP on our discoveries because it would be complicated by the materials IP that's built into it inherently. So it's more telling a company that we now have a new market that could expand your sales base or whatever by an order of magnitude or factor of 2, and that changes their cost structure generally by a significant amount. So there can be some places where I could see win-win in terms of IP and opening markets. It may be limited to my experiences, because I don't work on the device side of things. But there are cases where I don't think it's going to, it may actually, companies may actually see it as a benefit for them.
Just one quick thought on that. I think the IP and profitability is really a complex situation, and there are all sorts of other things: social entrepreneurship, manufacturing outside for outside market. I think it depends where your market is and what your ultimate, who the end user is and who the payer is for the product. And I think it's helpful if you do some of that analysis up front. So.
Can you just add one
Yeah,
last comment to
sure.
that? You know, I think PATH has done some really marvelous examples of taking technology that really was to be used in the developing world and discovering that they couldn't get manufacturing to occur, you know, with big pharma. And they went and they found people in places like India where there was a tech base, but not maybe a tech base at the level they wanted, used Gates money to get the tech base up to the level it needed to be, and then the manufacturing and sales is now leading to profits in India. There are ways in which you can, if you have the money and the time, in which you can scale the production so that it occurs in the developing world rather than where you usually expect it to occur.
Yeah. That's why the knee is being manufactured in Jaipur, in India. And so the same thing. I think we had one here, and then I think we're running out of time, so we'll take maybe a couple after you. Okay.
Good opening, the microphone, but,
Yeah.
Yvette Mirabal, Rice University. Thank you from Rebecca.
You're very welcome.
I just was wondering if you could speak to the challenges and maybe some lessons learned to conducting clinical trials of your devices in developing world settings, especially when they're technologies that aren't necessarily dual use and you might have not necessarily need regulatory approval or wouldn't be the sort of thing the FDA would even consider.
I'll start briefly and say that was, you want a real valley of death? That was the real valley of death that existed with the technology.
I really need to change my
No, I mean,
vocabulary.
I know it's a great phrase. I mean, this was a critical issue that we all recognized going into this project. And the problem really was that we looked at the $15.4 million, said, yeah, we could probably develop a device. Our original partner was Hewlett-Packard, and they estimated $200 million additional to get to production and getting it out there, okay? And we went, and Gates Foundation wasn't interested in spending that $200 million. So the question is, what do you do? For an instrument with an infrastructure, with a sales, all that sort of stuff is hugely expensive. So the answer is that the way in which they attracted companies to be involved in the project was saying, okay, we, the Gates Foundation, will dictate how you will deal with that technology in the developing world, but you get to do whatever you want in things that are outside the territory, which was places like US, India, Japan, Europe. So this dual use of technologies is probably the only way that complex technologies are going to get out there, where you have the incentive for the Western companies to really make money in that market. Because then they can go through clinical trials, do it in the US or Europe or Japan, and once they've got that, it's very straightforward to go to the developing world countries today and say, look, I already have approval. To go do it from scratch in the developing world would require country by country enormous amounts of legal issues and money, and it's very tricky to do. I'm sorry, that was all I had to say on that.
Yes.
Eva Harris from UC Berkeley, and I just wanted to mention, since we were on that IP question, it was just that we also had a gadget, a device that we wanted to get out, and this was, I don't know, maybe 8 years ago or so, but we actually had a surprisingly good interaction with the Office of Technology Licensing, where we essentially brokered an agreement for what then became called the socially responsible licensing, and actually became kind of a whole movement among a number of universities' IP departments, where you essentially split the world so that there is a royalty-free or a no-cost kind of situation for developing countries, but it allows the university to do kind of like a win-win or some kind of a positive or competitive interaction with companies for the developed world, you know. So we were surprised at how much they ran with it, and I think that that's something that, you know, I'm sure other universities are already doing, but it was just an experience to throw out there.
One more last comment. I thought I saw a hand on this side. Yes, very good.
Yes, hi, I'm Mary McCord. I'm in the Department of Biomedical Engineering at UNC and NC State, and also the Director of Global Health. I'm very interested in your feedback on, first of all, the dual or two philosophies about things like capstone courses or senior design. First of all, some of our instructors in engineering feel that this is purely a learning experience for the students. Other courses require the students to actually engineer products, and commercialize innovation. So we see different schools of thought, even within the university, among different programs. And I wondered if you had any sense of that same feeling that this should just be a learning experience for students who really don't expect anything to really come out of it versus the expectation that something's going to come out of it. Another comment that I have, and I teach in a multidisciplinary course, product innovation course as well, that brings in engineering, industrial design, College of Management, MBA students, and engineering students from multiple disciplines. And working with the folks from the MBA program, they really haven't addressed social entrepreneurship from the standpoint of social return on investment. And just to the comment, there's no return on investment. I'd really like to see a paradigm shift, especially around global health. And finally, what Dr. Hughes said about really not being culturally aware. None of the programs have really talked about integration of the other side of the university. And we tend to have this concept, and I hate this, this philosophy at a large engineering type university of, the people in the other part of the university that provide the service courses. And I hate that term, but they're really our partners in learning. But how do we engage those people? How do we bring that element, the other side of the university, the non-technical, the non-science, technology, engineering, math, into this whole process?
I can start off with that from this end. So the philosophy at Stanford, at least, is primarily this is an educational experience, though we anticipate that there will be several prototypes that will come out and perhaps some successful products also. And it has been the track record, so but that's not the primary purpose of the program. The primary purpose is to get that group of trained fellows who come out of this program and they've gone on to do all sorts of things. I think it's important to link up with the main campus, as you said, and I think we do try to make efforts to do that at Stanford in some ways. I probably could do more. We get people like psychologists and ethnographic studies to go on and the sort of cultural side of things as to what sort of end users are we talking about and what's their life like and how would this be integrated into their day-to-day life. And that's one of the reasons why we start off with doing an immersive program in the clinical setting for the purpose of clinical needs. And that's actually done in the setting where the clinical end product will finally come out to work, be good to use. So we have some of our students go and do the observation studies in Africa or India and other places as well. But that's an important point. Absolutely, I agree with you. And I'll defer to my other panelists here.
I'll comment on two parts of your questions. One had to do with the design outcomes, and I'll be brief, because getting into long discussions about ABET will give me a headache.